And this morning, I am joined in the studio by Sara Nemitz, who is a nurse practitioner from the Hayward area. Her and her husband have been up here for about 35 years and recently moved here permanently with their two dogs and her parents. Sara graduated from the Viterbo University in La Crosse with her bachelor's degree in nursing, and she has worked in emergency medicine for 20 years, including 10 years of emergency pediatric nursing at the Children's Hospital of Wisconsin. She recently received her Master's of Science in Nursing from NKU and is a board certified family nurse practitioner. And she is the owner and nurse at the Lakeside Health and Wellness company here in Hayward, and they are a supporter of WOJB. Good morning, Sara. Thank you for coming in.
Good morning. Thanks for having me.
Yeah. Well, I wanted to talk to you because there's something about this new diet fad that's out there. It's called semaglutide, and it's better known as Ozempic in some areas, and what was the other one? I'm drawing a blank.
Wegovy.
Wegovy. How could I forget that? And these were medications that were normally for diabetes treatment, and they had a side effect of losing weight. Now, more and more people are wanting it for losing weight, not so much for the diabetes element, but you also have diabetes or insulin, whatever the sugar. What am I trying to say?
Insulin resistance.
The insulin resistance of that. A side effect of losing weight is that you get better with your blood glucose level. So
Right.
there's kind of a two-handed element there. Talk about what this is and what it does and why it's so popular.
Okay. Well, first of all, the so-called frenzy right now, they're saying a lot of it is due to the mass information that's now out on social media. So everybody is able to access that information and see what's going on. Wegovy was approved in June of 2021 for weight loss. Um, and they have been doing a lot of studies on it to see the side effects and the benefits. It's a GLP-1, and what it does is it promotes boosts the insulin secretion that is released from the pancreas to lower your blood sugars.
Hmm.
It makes you feel full longer, slows down your gastric emptying in order to do this, and it also decreases your appetite, and you kind of have a loss of desire for food, and decreases food noise. And a lot of people have that so-called food noise in their head where you're always thinking like, when am I going to eat? What am I going to eat next? What am I going to make for dinner? What am I going to make for lunch?
Yeah.
So it's one of the few medications I feel that does everything.
Yeah, and it does for a lot of people. I will admit that I'm on Wegovy, and it's been a very interesting experience because, again, my desire for being hungry and buffets I never go to anymore because there's just no way. In fact, I eat meals that are probably the size of my fist, not individual servings of the different food groups, but the entire meal
Right.
is that big, and it's just interesting. Now, what are some of the side effects of being on this medication, and why would somebody choose or not choose to be on it?
So some of the side effects would be nausea, in extreme cases, vomiting, of course, constipation because it's slowing down your gastric emptying.
Okay.
So people, I always say, should be careful to eat all their fruits and vegetables, drink a lot of water, and if that's still not working, they can add fiber,
Yeah.
vitamins or gummies, whatever
Hmm.
works for them. And one other thing that I've seen a lot in people is acid reflux, but that tends to go away once your body gets used to it. And while they have it, they can just take, calcium or Tums for that to
Yeah.
make it go away. Um, However, the good side, the benefits,
Yeah.
the benefits are it can decrease your risk of cancer if you're overweight, decrease your risk of diabetes, and it also decreases your risk of heart disease. So I think each person has to kind of decide with their practitioner individually if it's for them.
Yeah.
Is it worth the risks, worth the benefit? And what is your BMI? The BMI, as we know, isn't always perfect. Your body mass divided by your height, and they don't separate genders with that. Um, or nationalities, because different nationalities have different amounts of muscle and fat.
Right.
Um, However, it does require that you have a BMI of at least 30 or 27 with coexisting conditions,
Mm.
such as high cholesterol, high blood pressure. Some people have like rheumatoid arthritis or osteoarthritis, and an extra 10 or 20 pounds is just a lot of pain on their joints.
Yeah. Right. Well, I've noticed personally, again, I went to my doctor. We discovered that there was some prediabetes in my blood work. And then I came to you for a consultation and we found the same things. And I really wanted to start it to not venture into the diabetes realm. I wanted to keep my blood sugars down. And of course, I've always been told by my primary care doctor that, Mark, you're a little overweight. You need to lose weight. You need to. And it was like, okay, I've heard this all before. But I really never had something that would help motivate me, except for this medication. It's been something now that I've lost probably 20 pounds already, and I'm already feeling it in my ability to be mobile because I have mobility issues with my feet and one of my knees. And having that less weight has really, like you said, put less stress on my joints and my feet. And I've been feeling it there, which has been a motivation to be more active. And of course, now I got to think about exercise in beyond walking or riding a bike, maybe lifting some weights to build that lean muscle. And that's been something that's been really key for me. And I know it's been for a lot of people. In fact, Wegovy and Ozempic in their smaller doses has been very, very scarce. I had to look at 3 different pharmacies to
Yes.
find the medication. What and how has that been
It's been
alleviated now, or is the
no.
supply catching up?
Unfortunately, it's still going on, and that's why the generic form, semaglutide, the FDA approved it to be made by the compounding pharmacies because they can't keep up with the demand, and there's a clinical need for it.
Yeah,
So, and the difference between semaglutide and Wegovy and Ozempic are the same drug. One is approved for weight loss. One is approved specifically for diabetes.
hmm,
You can interchange them. It's the same drug. However, semaglutide is the same drug, and they have to have an added ingredient to change the formulation a little. So the one that I use for myself actually has B12 in it. Some of them have carnitine or different vitamins that they add to it just to make it a different formulation, so they're not using the exact patented
sure. That
formulation.
these name brands are using because there's a patent on it, so they
Right,
have to make it different.
right.
Yeah, interesting.
So, yeah, I am myself. I've been on since May of last year, and now I'm just coming up on 50 pounds that I've lost. And the first 3 months of that, I had a broken leg, so I wasn't moving much at all,
Yeah,
and I was probably eating more. So it's been slow, but 1.5 to 2 pounds a week is the average weight loss. And as long as you're losing that, um, you stay at the dose you're at, you can. You can opt to go up. But normally, if you're losing, I recommend that people stay at the dose that they're at.
Yeah. Because there's really no set dose. It's just depending on how your body responds to it.
Right. There's a protocol. The protocol is 0.025 for the first month and zero point 0.5 for the second month. The third month is 1 milligram, which is actually considered the therapeutic dose. The other two are getting your body used to the medicine.
Yeah.
And then it goes to 1.7 and 2.4, but some people never get to those ranges because they don't need it.
Mm-hmm. And how long are people normally on this medication? Is it a forever thing, or can they, get to their ideal weight loss and their blood sugar levels and everything's looking honky dory and they get off of it? I've heard that old habits are hard to beat, and some people go right back to their, I don't know how that can happen, but because again, I don't have those hunger pains, but not being on the medication, I can't imagine after a year, those hunger pains would just snap right back, and here I am again.
Yeah. Well, there's two different schools of thought, and all of the conferences I've been to lately about obesity and weight loss, they're telling us that obesity is a disease like any other disease, and you will always be treating it because most of us who get overweight, our whole life is up and down,
Yeah,
losing, gaining, and
right.
that's not good. That's not good for your body. So they're saying like get to where you want to be, maybe taper down to a once a month dose, maybe every other week. That being said, I do have probably several patients who have lost the weight within about 6 months, and gone off, tapered down and gone off the medication and are doing just fine. My earliest ones would be starting from September of last year. So I haven't seen more than that
Yeah,
yet, but I think that's pretty good. And I see the people around and they tell me how they're doing, or they text me or call me and let me know how they're doing. And a lot of them have been doing very well.
yeah,
So that's good news.
yeah. Um, in the in what you practice, you don't you're not a with a national clinic or a regional clinic. You're on your own
Right.
with this, and you don't necessarily. It's all private pay
Yes.
with what you do. Now, people can still submit their treatments to their insurance
Exactly.
themselves. But unlike a clinic in town where they would submit all that stuff to the insurance and then you pay what's left over, you ask for your patients to pay up front, and that's how it works. And they can use their HSA or FSA or other personal funding resources.
Right. Um, Unfortunately, I have to purchase the medicine myself, and so that's the way it
The
has to
upfront
be.
cost,
However, it is a lot less than the brand names, and just so you know, the Wegovy is $1,349 a month for all the doses. They charge the same price no matter if you're getting a total of a milligram a month
Oh,
or
okay.
10 milligrams. The way it's actually sold in the compounding pharmacies is it's sold by the dose. So if when you're on higher doses, it costs a little more. When you're on lower doses, we can get it a little cheaper. Um,
Yeah,
but the prices for the semaglutide, I would say, are about 200 to 800 a month, depending on where you're getting it. Now, of course, 800 is going to be in the big cities. A lot of people have memberships, and you come in and get your shots every week. You can, once you start the program, get your own vial and come in monthly or order monthly. It just depends what's more convenient for you.
yeah,
But the average, I would say, is about $300 a month.
yeah. How hard is it for your patients that are coming to you? Maybe they went to their primary care doctor and their insurance wouldn't cover it. And how many people do you find with that story?
I am getting a lot more of those now that people know that I'm here. Um, a lot of my patients were just coming to me, and I have several different weight loss programs,
Yeah,
so they weren't all for semaglutide. But now that a lot of the providers know that I'm here in the community, when their patients are not getting approved and they can't afford the $1,300 a month, then a lot of them are coming to me,
yeah,
even if I can just fill in the interim while the shortage is
sure,
here
right.
until they can get what they
Get
need.
what they need. Yeah.
I'm happy to do that as well.
Wow. Well, we have some remaining time here. I wanted to ask about another interesting treatment, and it's called stem wave. And I'd never heard of that. And talk about what stem wave is and how it helps people.
Okay, stem wave is another treatment that I got really interested in. Um, Not only for myself and my family, but everybody as we're aging,
Yeah.
we're getting something hurts every day. I mean, after 40, pretty much something's going to be hurting you every day. We can usually function, but it kind of affects our day to day
Yeah.
life.
Right.
So this machine is kind of a natural way. A lot of chiropractors use it. When I went to training, I went with it was all chiropractors in my class.
Mm,
The other reason for that is it has not been approved and insurance companies do not cover it.
okay.
So you can't get it when you go to your regular clinic, your regular primary care provider with your insurance.
Yeah.
But what it does is it reduces inflammation to the point of a lot of times people will not have to have that steroid shot or have that surgery. They can hold off on that. Maybe they don't have time. Maybe they can't afford it. But these treatments send it's a kind of an ultrasound head that I run over the area, and it takes 5 to 10 minutes for treatment. And it sends a shock wave through the skin. Um, it doesn't hurt. It sounds like it might hurt,
I was
but
going to say a shock wave. It's like, are
yeah.
we shooting electricity into our bodies and
Yeah, no,
zapping
it
us?
it sends a shock wave, and what that does is it increases the blood flow to that area, and the stem cells come and they go to that area to try to heal it. Um, a lot of people can tell by their first treatment if it's helping or not. A lot of people have a big improvement in their first treatment, and that's how I can tell, yeah, this is really gonna work for them, and then we set up maybe 6 or 8 more treatments. I've
Yeah.
had neck pain that it's been really good on. I've had knees where people couldn't sleep before, now they
Mm,
can. Plantar fasciitis, carpal tunnel, tendinitis in the elbow.
yeah.
There's a wide range, but it's for
Interesting.
musculoskeletal.
Okay.
Mhm.
Yeah, I just never heard of it until I came across your clinic, and I thought I just didn't know what it was, and I don't think I need it, but I do have bursitis in my right hip. Maybe I'll have to
Yeah, we could
check
try it
that
out.
out.
I treated my frozen shoulder and it worked very well.
Yeah.
Yes.
So, um, well, I think that's about it. Did you have anything else to share about some of the services that you provide or that are available?
Um, well, we also do B12 shots. We do immune boosting shots, which is a combination of vitamins, vitamin C, glutathione, and zinc, which those are the vitamins that sometimes people take orally to
Yeah.
prevent colds, but it just gets into your system faster. Um,
Yeah, because I've known people say even when you take vitamins orally, the digestive system can destroy a lot of the effectiveness of those
exactly.
things.
And you don't
And
know how much you're getting.
great,
By the time it goes through your GI tract and then it has to do the first run through your liver, and I just I don't like oral things overtax your liver, and I feel like our livers are taxed enough.
Especially in Wisconsin.
Yes, yes, I'll agree. Oh, which is another good point of
Yeah.
semaglutide. It prevents a lot of extra drinking. For some reason,
Oh,
it does something to the trigger in your brain, that reward center, and they're doing studies right now to use it for addiction.
huh.
Mhm.
Interesting.
So people are drinking a lot less when they're on it.
Okay. Very interesting. Well, Sarah, thank you so much for your time and coming in today. Appreciate
Of
that.
course.
We've been speaking with Sara Nemitz, a family nurse practitioner of Lakeside Health and Wellness. And information is at lakeside.healthcare. And again, we want to make sure that we recognize Lakeside Healthcare and Wellness as a supporter of WOJB. Sarah, again, thanks for your time and
Thank
your
you.
information.
Thanks for having me.